Dr. Jones, it is said that people who snore, which is apparently a fair amount. I mean, everyone in my family, everyone in my wife's family, and my wife and me, we both snore. So the point is, lots of people snore, and it looks like that an awful lots of people, of those who do snore, also have a little thing called sleep apnea, to a higher or lesser degree, of course, meaning they stop breathing throughout the night, sometimes for up to a minute, and sometimes up to 20 times a minute or whatever, 20 times an hour. Anyway, lots of time, way more often than they think. They don't not necessarily have to, and there are many degrees, but they do. And it in itself is called sleep apnea, and it deprives a person of sleep without him knowing. It's camouflage. You know, at least if you're out partying, you know you're not sleeping. This is there's some advantage, you know what I'm saying? But there you don't know it, and then people apparently get extremely tired in the afternoon to the degree where they pass out. There apparently are more car accidents from sleep apnea than from drunk driving. In New Jersey 2 months ago or whatever, a guy wrapped a bus around a ball, and they suspect sleep apnea. Bad thing. And that doesn't count the normal fatigue a person has. And while there is a golden standard of fixing sleep apnea, which is a CPAP machine. It's a machine which pumps oxygen into your mouth, but it's, you know, as a mask, you become an alien. It's expensive. There seem to be the appliances you dentists make, which are snoring appliances, which seem to be maybe not quite as good as the sleep apnea machine, but very, very good, and people wear it because the other machine, most of them, even if they have a prescription from it from the doctor, they still don't wear it because it's awful, apparently.
I've heard that time and time again, where the people have been diagnosed with sleep apnea and they have been prescribed a CPAP machine, and they just don't use it. They don't use it. It's cumbersome, it's bulky, all the things that you mentioned, they just don't use it. And while as a dentist, you know, I don't make it a practice to treat sleep apnea, I do make anti-snoring devices. And the beauty is that with any person that even thinks they have sleep apnea, there are sleep centers that a study can be done to measure the quantity and the severity of their sleep apnea. And the same sleep study can be done with a dental appliance inside their mouth to see whether or not this has controlled their sleep apnea, or if it's better. And so,
and you know, sorry to interrupt you, you simply know, you might not have it, and this is a good point you're bringing up, because those sleep apnea studies, you need to usually go to a guy, sleep in his house or whatever, his office for a night, and so they hook you up, and it's very expensive. Now, insurances might or might not cover it, that's, you know, that depends on what the person has. But the point is, it's actually, especially if it's not super severe, you know, like very obvious, because very obviously this whole sleep apnea thing has not been obvious to the medical field up till literally now. They know it's existing, but it was apparently something some people have. But now they start going, whoops, maybe many people have it. But put that sleep apnea on it, and next morning, literally, I mean, maybe it takes you a few days because maybe you got to get a little bit used to it or whatever, I don't know, but apparently you simply will be feeling more energetic. And if you feel more energetic, your sleep apnea is partially at least cured, because sleep apnea, this appliance or the CPAP machine is like glasses. If you don't put them on, you don't see. If you put them on, you see. Simple. Right?
Well, you know, there's another way, Helmut, that you might be losing sleep at night if you snore, but you don't necessarily have sleep apnea. And that's if your wife or your spouse keeps rubbing you or pushing you to roll over, to change position. You may be waking up many times during the night, but you're also waking up them. And so with the anti-snoring device, you get a better rest because you're not being woken up that many times by whoever you're sleeping with. So I think that's a good point, though, that if you do wear an anti-snoring device, it opens the airway, and you just get better oxygen without even having to adjust to it or to realize it. I use one, and the very, very first night I noticed I was getting more oxygen at night. My wife said, "You didn't snore at all." I didn't wake her up. And so she wasn't waking me up to reposition me so I don't snore for the next 10 minutes. But it's the amount of oxygen that it just brings into your system while you're wearing this, because it opens your airway mechanically because you're wearing this between your teeth, and it just really is helpful. If somebody truly did have sleep apnea, though, I would just really encourage them to have a sleep study test done.
Sure.
To see their physician, because it can be very, very serious. And if a CPAP machine is the only thing that will cure them, then I would be the first one to recommend that. But I've had, several instances where people have had sleep apnea where they have been able to put an anti-snoring device in, and because their condition was mild to begin with, they went back to the sleep study, was studied again, and with the CPAP machine, it's not the end of the world either. You still have to be retested to make sure that the CPAP machine is working and doing its job. So those kinds of things are what we notice when we're using an anti-snoring device retainer, because that does open the airway and does increase the oxygen.
Right. And oxygen, it gotta be the most important thing. We know that because we can only live
We do know that. We can't live very long without it.
Yeah, right. And the deprivation of oxygen as well as deprivation of sleep must be the two things which make you insane the first, it just goes like that. Just, we know that if you wake a person every few minutes, that's how they, pretty soon he will be in an institution. And it's just not a good thing.
Well, brain cells will die. Yes, brain cells start to die off, and right. Start losing our brain capacity. So all of these things are tied together. Absolutely, you're right, Alan.
Good. And, I wasn't too long time ago, a year ago, I was talking to a guy who is like a sports teacher and, that's what he does professionally. And I thought I was smart, and I asked him, I said, so, what's the best exercise to do? And, I expected something like swimming or so. We read the newspapers. We after all, are very smart people, right? So, and he looks at me, smiles, and he says, well, Helmut, the best exercise there is, which you can do, is the one you will do. Yeah? And it was like so profound, so deep. I felt, of course, also so stupid, kind of, because, again, I'm a very good example. I love skiing, except I don't do any other exercise. So how often do I ski a year? 3 times? 4 times, maybe? Do you know what I mean? And so I exercise 4 times. That's like, saying I just had Thanksgiving turkey and I ate way, way too much, so I don't need to eat for a week. That doesn't work, right?
Right.
And so it's the one you will do. So CPAP machine, yes, most likely wonderful, except will you do it? So this one is a good way to start off. And with no doubt, if you have a spouse, besides of whatever effects for you, which you should be important.
Much easier to use than a CPAP. Yes, you're absolutely right.
But as you said, you're definitely doing your spouse a favor, because your spouse might or might not have sleep apnea herself or very little, but she surely will have that kind of effect because, you wake her up all the time.
You wake her up all the time. And if you're not waking her up, she's getting a better night's sleep. She's going to be a more pleasant person as well as you. So it helps both of you. That's exactly right.
Right. And even if you snore and you don't have sleep apnea, number one, as you said, you wake her up. She now wakes you up in return because she goes, turn over, right? So you might not.
It really is sleep apnea because you're being awakened many times during the night. Yeah, you're right.
Exactly. Well, all right. So and again, it's amazing how much you dentists fix. From a caved-in, dried-out face looking ugly because of you're putting you're making the bones fill up from beautifully looking in the first place, which is we know $1 million smile, from headaches because your teeth are out of alignment, from saving the kidney, the liver, and diabetes and stillborn babies and naming because of gum disease fixing. Jesus. Anything you guys don't do now, it's sleeping and being able to drive safely. And be energetic, which, again, I personally believe, I know people, and on an average, I'm very energetic. And my wife, about 4 or 5 years after, we were married, I remember, maybe much faster, maybe 4 or 5 months, what do I know? Anyway, she kept saying, are you upset, honey? Are you upset? And I go, no, I'm not upset. And then it took her a while to realize what happens is, she said, you're not upset, you're tired. Because when I'm tired and exhausted, you sit a little dead on the kitchen table. You don't have new things to talk about. You don't want to.
Yeah.
And so, and I know people who wake up tired and exhausted, probably because of sleep apnea, maybe not, but probably. And to lead a tired and exhausted life is a very uneventful life. It's just not good. So maybe the sleep apnea, maybe a snoring device is the solution to an afternoon coffee pick-me-up or a Coca-Cola or a Red Bull.
Absolutely.
Red Bull.
For many people it is. For many people it will absolutely have that same effect. And going back to the other, we do lots of things. Helmut, it's because I care so much about the people that I enjoy working with that I want to see them have a healthy and fruitful life and a successful life. And if they're tired all the time because they're snoring a lot, or if their whole body health is impaired because they have gum disease, or
they have headaches or whatever.
Toothache, if they have a headache and they're just they can't focus on anything because their headache is so bad, or their earaches, or they have a toothache because they have an infection, or they don't like the way they look because their bone has been lost due to teeth that are missing or whatever, then these people are not having a very fruitful life. And however I can help them enjoy and increase the success of their life, that's what I say I'm a people person and I'm a dentist because I like to help people. And this is the way that I've been able to help the most number of people, is because I do care about them. And in my little world, which is the head and neck, that's where I want to start, and I want to see them thrive.
It's a little work, but it is definitely far-reaching. It encompasses many, many dynamics of life.
Yes.
Pleasant talking to you, Dr. Jones, again. Bye-bye.
Thank you, Helmut. Bye.